Yeah, I gave you a provocative topic name here, but there's a great deal of truth in it. And indeed, a little bit about my practice. I started replacing hormones in 2004, and I immediately began attracting all these fatigued, brain fogged, achy people who nobody could help, and they thought their problems were hormones, maybe thyroid, maybe adrenal insufficiency, and now most of them have Bartonella and Babesia, is what I have found. Both. I'm here because of Valerie. When she was 10, we had moved back to our home where I grew up in northeastern Pennsylvania, where I never saw a tick in my life. Here I come back in 1995, and then in 2003 I found 2 engorged female deer ticks on her. They were under her hairline, so it was, covered by hair, hard to see. She didn't get a fever, she didn't get a rash, so according to CDC, IDSA guidelines, nothing happened and they're fine. And if they do get either of those, you get 10 days of doxy and you'll be fine. But anyway, very gradually, unknown to me, she began to feel more depressed. She found it harder to do things mentally, like to draw. She couldn't concentrate as long or as hard as she used to. She developed a bizarre hunger where she had to eat to feel like she could function, to get rid of a very bad malaise. We found a way to kind of keep her going with the distraction of taking courses at colleges. She was unschooled. But by age 25, she couldn't continue with her schooling anymore. And she told me one day, Dad, every single emotion is painful, whether it's a good one, a bad one, or anything. It just hurts. And even good emotions, the few that she could have, would hurt. So when she was 25, it was time to get, I'm a doctor, so I knew other doctors really didn't know anything that would help to figure out what was going on with her. But we had to try. So we saw a neurologist. He did a brain MRI, and it did show these white matter hyperintensities, which shouldn't be there in a 25-year-old person. They're often seen in older persons who have microvascular disease. Her EEG was a bit abnormal. Mayo Clinic autoimmune encephalopathy panel was negative. And finally figured out, she must have some kind of infection from those ticks 14 years earlier that had caused her to gradually deteriorate in this way. We saw Dr. Mast, which some of you may have heard of, because I didn't know anything about these diseases. I'm going to go see somebody who's got experience. And he did the IGeneX panel, everything negative. He gave her high-dose doxycycline, like 600 a day, for a couple months. And she hurtsed, but she never got better. And then when he added Mepron, after about 10 days, she became, she had intense herxing, and both with, prominent mental suffering and physical suffering. And so we had to stop it. Same thing with hydroxychloroquine. Then we got a break. A few months later, Galaxy came through with a positive antibody test for Bartonella. And several months later, T-Lab had developed a FISH test for Bartonella henselae, and it was positive. But months and months of Dr. Mosaieni helped us, his rifabutin treatment for Bartonella. It herxed her terribly. She was ill, but she never got better. And eventually, on the highest Bartonella dose, or highest rifabutin dose, her symptoms changed. And I think we started killing Babesia. Several months later, and this was really after about a year and a half of trying to treat these infections, she got a positive test at IGeneX for Babesia with the FISH test, which shows that there's a current, ongoing. There are Babesia in your blood at this moment. It was negative the first time, but it was positive after and during she was doing some treatment. But every time we tried to treat the babesiosis with Mepron, with Artemisia, with you name it. She would get so upset, crazy, throw things. She was so uncomfortable we had to stop. She couldn't endure it and I couldn't endure it. So we're wondering maybe this is some sort of autoimmune thing because if we can't treat the infection, so let's look down the autoimmune road. She had a positive Cunningham panel with the anti-D1, which is very characteristic of marked dysphoria, anger, irritability. We tried low-dose immunotherapy for 8 months. Let's see if we can reduce her reaction to the Bartonella and Babesia we knew that were there. But she would get temporary improvements. She got an initial improvement that was amazing, but then it went away, and continuing to increase the dose just didn't help and flared her. And we tried over and over. You take 2 months off and you try again, and we couldn't get it to work. Saw another neurologist, and he diagnosed seronegative autoimmune encephalitis, and he did so based on a very abnormal PET scan of the brain, which I'll show you. He advised high-dose steroids. We tried to put that off for quite a while, but eventually we did it. That's a 5-day course of 1,000 of IV Solu-Medrol, and it didn't help. But when she withdrew from that massive amount of immunosuppression, she got tremendously worse. She couldn't get off the couch. Her eyes were covered, her ears were covered. She couldn't walk outside. And at that time, I had to take over her care. This was 2.5 years of her not getting better and getting worse with everything we tried. And I knew we had to kill the Babesia, which she could not tolerate any treatment previously. So I gave her basically a very strong cocktail because she was on hundreds of milligrams of prednisone a day, which I gave her because after that withdrawal, she was so ill, and she knew that she had to take a certain amount so that she could get out of bed, she could eat, she could sleep. So I gave her this combination, rapidly added in atovaquone, Dr. Zhang's Artemisia, which is now called RTM, azithromycin, and this very potent antibabesial I had read about that showed great promise in mouse studies called tefenoquine. And it is the most potent antibabesial we have next to the artesunate or Dr. Zhang's RTM. She had very severe herxing. She was actually getting plasmapheresis from the neurologist at the time, so I knew this was the time to try to kill these Babesia. She was doubly immunosuppressed, so her immune reaction would not create such a problem. She had massive hemolysis. As you'll see, Babesia are intraerythrocytic parasites. They're in the red blood cells. And she was and still is the most heavily infested person I've ever seen. And she had massive hemolysis. Her plasma turned red, her urine turned red with heme from killing so many Babesia with this very strong cocktail I gave her. After 10 days, there was an amazing improvement. She could walk. She came to the porch. She wanted to go for a walk. But she had severe derealization, depersonalization. She like her life didn't seem real. She didn't know what was going on. How could she possibly get better? She thought she never would. And I think that derealization was from a temporal lobe bleed that happened with killing so many Babesia that were in the blood vessels of her brain at the time. A later MRI showed it. For 6 months, I gave her very potent antibabesials. I called that the AAT, azithromycin, Artemisia, and tefenoquine. But she just wasn't improving. I mean, she still couldn't get on the phone and talk with people. She couldn't write emails to friends. She could barely, have a conversation with somebody. She had to really conserve her brain energy, and everything irritated her brain. So I read this paper by Shedders, which you see linked at the bottom there, on Babesia canis. And the fact that, because I was reading extensively, I'm a researcher and a thinker, and I found all this research on sequestering Babesia species. And Babesia canis is one of them, and it was studied in dogs because dogs get studied because they're our best friends. And other animals that got studied are cows that have another sequestering Babesia species, Babesia bovis. Well, Shedder's documented how this Babesia canis gets into red blood cells, causes fibrin to get deposited on the surface of the red blood cell. The red blood cell becomes adherent to other red blood cells and to the linings of capillaries. And so it sticks in capillaries. And then more infected red blood cells stick there. Uninfected red blood cells also stick there. And essentially this kind of Babesia species creates a nest in the capillary and in the postcapillary venules where the blood does not flow. The species exists, eats hemoglobin, goes from infected red blood cells to some of the uninfected ones that it got trapped in the nest. And when it runs out of food, it goes into a kind of a hibernation state or a persister state. So I gave her lumbrokinase. This is the first time this was done so intensely with somebody during treatment. And I saw amazing differences. She actually could start doing things again, but at the same time, her need for corticosteroids kept rising and rising and rising, even though she was, more able to function. Until eventually, her urine turned a dark red-brown. It was full of hemoglobin. She had, there was a very heavy nest-clearing die-off going on, essentially. And we had to stop. She ended up on very high dose for a long time because I really didn't understand at the time if it was due to stopping low-dose immunotherapy or due to this lumbrokinase I gave her. But what eventually happened then over the next couple years is we gradually reintroduced the fibrinolytics and at greater and greater doses. And it took 2.5 years to get to where she could take lumbrokinase and nattokinase at their highest doses. Because every time she would take a significant amount, very quickly, the release of these organisms from the nests would lead to intense Babesia killing and an immune reaction that could become very severe. I also did substitute rifabutin for azithromycin at some point because we knew there was Babesia. I thought Bartonella, and I thought Bartonella probably had a lot to do with her emotional problems. And indeed, she had increased herxing when we changed from azithromycin to rifabutin because it's more potent for Bartonella. She actually got well enough to go back to grad school, but only taking one course. And what happened is that she had some intense emotional and of course, brain effort was involved in being at school. That brought a great deal more inflammation, herxing, hemolysis, and I believe it's just very simple. You bring more blood flow to parts of your brain that are active, and the emotional centers were a big problem for her, I think heavily infested. This is she's a very well-documented case, and when all her tissues have been tested, and if we can, find everything we want to find, I'll publish it. This is before antibabesial treatment in 2020. She had only had, at that point, the rifabutin for Bartonella, but we fortunately went to we had the MRI done at the Marcus Center outside Jefferson, or it's part of Jefferson Health. And the guy who read it is really a top expert in understanding what PET MRIs mean and what activities in different areas mean. And he basically, in his report, described how all these changes explained what was happening to her. So this is what PET MRIs look like in a lot of the people who are very sick, and especially if they have severe brain fog, emotional disorders, psychiatric disorders. Large parts of the cortex aren't working well. Other parts are hyperactive, which you see the basal ganglia, which is the center of emotional center and involved in a lot of other integrative activities in the brain. And you can see after 12 months of clearing these nests out of her brain's blood vessels, there was a great improvement, which was shown in the fact that she could talk, she could communicate with people, she could read, she could take a course again at school eventually. But again, worst case. I have not seen anybody who needed this kind of intensive, long-term fibrinolytic therapy and was so slow in being able to increase it. So what are Babesia? They are protozoa. They're very closely related to malaria. Falciparum malaria, the most dangerous malaria species in Africa and Asia, is a sequestering malaria species. It infects red blood cells, the Babesia. They are killed by the same things that kill malaria, so it's anti-malarials. They have this incorporated bacterium, and this is important to understand because this incorporated bacterium, the apicoplast, makes them sensitive to antibiotics to a degree. So they herx. People with babesiosis herx when they take doxycycline to a degree, more so with azithromycin and rifabutin and rifampin. Anything that is a so-called intracellular antimicrobial can cause a person with Babesia to herx to a degree. But it won't cure them, and it won't get them better. What Babesia species infested my daughter? Well, when she got that Babesia fish from the Igenics, I called up our PA tick lab. It's a state-funded lab. They do tick testing. Many of you have probably sent ticks to them. They're in East Stroudsburg University. And I spoke to their resident expert, and I asked her, you know, my daughter tested positive for Babesia by a fish test, so there's a chronic infection here that infectious disease doctors deny. And she has antibodies to Babesia duncani, which is what the Igenics test returned. And she said, well, there's no duncani in the ticks. We've tested 5,000 up till now, and what do you find in the ticks? Babesia odocoile. It's in 20%, she said, of the ticks that she has tested, the deer ticks. The Babesia microti, which the IDSA, Infectious Diseases Society of America, CDC, say causes almost all babesiosis, is in less than 3% of the ticks. So we've got this terrible problem with the deer Babesia being in the deer ticks and infecting humans to a large extent. It's not duncani, it's only in the West Coast, and it's a different tick. Odocoile has been found in 10 up to 30%, in one study up to 40% of deer ticks found in different situations. The host is the white-tailed deer, that's where it gets its name, odocoile. It is a true Babesia species. It's the real thing. Microti is called microti because it's small, it has a small genome, and it really has no tricks. It doesn't sequester. This odocoile is a real parasite. It gets into you and it never leaves. It's lifelong infestation, but it's also such a good parasite that most infected persons and deer don't even know they're infected. They may have very little illness, but for some, there is illness and sometimes severe illness. It was first proven that odocoile infests humans only in May of 2021. So this is relatively a recent story. And I want to say a little bit about the progression of our knowledge of tick-borne diseases. Everything is Lyme. Everybody talks about Lyme because Lyme was the first one known and well understood. The mainstream understands Lyme to an extent. And so everybody who's been ill chronically is thought to have chronic Lyme. Many of them had Lyme from the ticks that bit them. But in recent years, we have basically gotten good tests for Bartonella and for Babesia, and that is really changing the story. Our previous presenter talked about transovarial transmission. Odocoile is the real thing. A true Babesia species that is transmitted transovarially. So every one of those 2,000 ticks, 1 to 2,000, from an infected female deer tick is infective to humans. Every one of those larvae. And they are tiny, they're practically invisible, as you can see here. I've had people tell me that they got into nests, where they had just been born, and they get covered with these things. Tiny little things you can hardly see. One mother got a brush and brushed them off her baby. And so we've got a huge problem. Lyme is not transmitted transovarially. Neither is Babesia microti. Only a very few kind of fringe other organisms are transmitted transovarially. As is mentioned here, only nymphs can give you Lyme. And so I think it is quite possible that babesiosis is much more prevalent in the population than Lyme disease. And we have a much higher risk of it because of this transovarial transmission and the fact it's in a significant percentage, 20% of probably the female deer ticks who get pregnant and feed and are able to lay eggs. And you may be aware or maybe not that IGeneX gets more positive Babesia tests than Lyme tests. And I mean just whatever's sent to them, they have a higher percentage of Babesia positives in the samples they get than Lyme positives. About 37% to about 30%, I think. So a little more about cytoadherence and sequestration. This is what I read about when I was trying to figure out why my daughter was so ill and for so long, and why her brain practically couldn't work. As mentioned, it gets into the red blood cells, fibrin accumulates on the surface of the red blood cell. See, red blood cell is a perfect vehicle. It's a cell without a nucleus. It has no direction. It has no control. The Babesia get in there and they become the nucleus. They take over the red blood cell and its functions. And they get it the surface to become sticky. This probably just involves a few molecules that migrate to the surface of the red blood cell. And so you get these nests basically throughout all the tissues of the body. And that's why the symptoms are everywhere. They proliferate within those nests. They can, they make more merozoites. Here's a picture from Shedder's paper of what a nest looks like in the brain of a dog. And you can see there's these uninfected red blood cells. There are infected red blood cells. It's hard to see the Babesia. They're these little tiny things. They have small nuclei compared to the human cells. And these are permanent. They do not go away. As a matter of fact, they grow. And they grow into the venules that are after the capillaries, which are larger blood vessels. And so you get very large nests. And so you've got this microvascular infestation. Like I said, in many people, the immune system controls it very well. They don't have an extensive infestation. But if there is enough of them, you get this ischemia. There's poor blood supply, poor nutrient transfer. You get some inflammation around the nests. You get these mechanisms that have been described in falciparum malaria very well, with nitric oxide increases, capillaries become a bit leaky, and because of the inflammation around these nests, there's a process that leads to ATP consumption in the surrounding tissue. ATPs are energy molecule, and it is consumed repairing DNA nicks, basically, damage to DNA by the inflammation process. And so ATP is used up. And this is why Babesia is the most understandable cause of severe chronic fatigue and poor stamina. Literally, you don't have enough ATP. Your cells, your mitochondria are dysfunctional, and the ATP they do produce is getting consumed by the inflammatory process from these nests that are in all tissues everywhere. So you get this multi-organ dysfunction. These direct effects, this is all my daughter had for the first 14 years. She had no Babesia symptoms. You hear about Babesia, air hunger, night sweats, fevers, and so on and so forth. She had none of that. She just seemed like she was hypothyroid because her tissues didn't have any energy. Her bowels had no energy. She couldn't stand the cold. She did have this bizarre appetite. Her body temps were always low. And she became progressively disabled. Only after she started reacting to the organisms did we start to see these symptoms on the right. That's what happens when you have an immune response to the Babesia. And she had no immune response, apparently, for those first 14 years, for reasons I'll speculate about. So when you get an immune response, you get all the classic symptoms, air hunger, you get mast cell activation, so it'll look like MCAS. I think it's the primary cause of MCAS in most people, is this combined infection. You start to get anxiety very common in Babesia-infected people, and responds to treatment. Pulmonary issues, rheumatologic issues, cardiac issues, you name it. And they love the brain. The brain is you can imagine, you have these blood vessels, there's no pressure, there's nothing causing the, disturbing the nests. And so it's a very nice place for them. And so you get this low stamina. Many people will end up with the white matter hyperintensities because there's leakage from capillaries here and there. Neurotransmission is distorted by the combination of Babesia and Bartonella, which is another intravascular infection. The basal ganglia of the brain are the most sensitive to inflammation. It's the most sensitive area of the brain to inflammation. And so it is most affected by these infections, which can lead to anhedonia and anger and irritability. So what about testing? Well, this infection has remained invisible because IGeneX only developed their FISH test, I think around 2005, 2010. So it wasn't until then that there was even a test that could show that there was Babesia, because you do not see Babesia otocoile in a blood smear. And that's because it sequesters. You see Babesia microti, or you might see otocoile in an acutely infected person. But generally, it's this, and the veterinary literature describes other sequestering species. You don't see them in a blood smear. But some tests are positive, and all the usual tests are negative, CBC, ESR. And you see, this is one of the reasons doctors don't get it. They get this training in bacterial infections, and so they think anybody who's infected should have an abnormal white count, a fever, and some obvious evidence of infection. So these parasitic infections, they don't even begin to understand, and they don't want to deal with them. IGeneX is a very good source for testing because of their FISH test. It used to be the Babesia duncani antibodies would be positive as a cross-reaction to the person's Babesia otocoile antibodies. But they have an immunoblot now, which is a little more specific. So people will often come back negative for duncani and microti, but positive for some Babesia species antibodies, which is otocoile because it's what's in the ticks. T-Lab, when I called Dr. Mozieni and having figured out what was going on with my daughter, he developed a Babesia otocoile FISH test, and he has a Babesia genus FISH test too. So those are basically, were it. Until recently, Galaxy has developed a more sensitive PCR test. And again, this is why otocoile has been invisible. There was no PCR test that could detect otocoile because they didn't have the right targets. But they found a target, not the 18S mRNA that everybody else is using. They found, Galaxy found it would not differentiate between Babesia species. They found a different target, and now they're detecting it in people, and you can get this BBB direct PCR from Galaxy, which will look for all three by PCR. And again, no other laboratories can detect these infections, Babesia in particular. So you get tested at LabCorp, you get tested anywhere. Their PCRs aren't for the right species, and their antibodies aren't for the right species. What about treatment? Well, as I've said, people vary from very minimally infested and sick to very severely. Some people just need a little bit of antimicrobial or even herbals to suppress the infection a bit, and they're better. Others need the whole Monty, like my daughter did, and most people are in between. But it's very highly, Babesia species are very highly resistant to antimalarials, as shown in this study out of Yale. So I take advantage of synergy. I'll often start with a tovacone so that Herxing and improvement will serve as a kind of diagnostic test to prove that indeed they are suffering from babesiosis. And just gradually ramp it up until, they, as much as they tolerate, and until they get as well as they need to be. If they get as well as they need to be, I don't even have to go into clearing nests. Let the nest stay there. Just get the person functioning and feeling well enough by suppressing their Babesia load and basically, killing all the ones that are exposed to the immune system and causing the reaction. And I think you need to understand that neither of these infections, Bartonella and Babesia, they're not curable. You will never cure them. And it's because of the nests. You can't clear them all, you can't get rid of them. Even if you, erode the outer parts of them, you'll not clear them all. So it's about getting somebody well enough and then keeping them well. I've seen only a few people who could stop and stay better. And that does happen. Maybe their immune system controls the smaller load fairly well. But others stop, and in 3 to 6 months, they're much worse again. And they seem to be harder to treat after that because they herx harder. What scares patients and doctors is the prolonged and severe herxing. Because there's no quick cure. You're basically going after these nested parasites. And they're isolated. I saw an interesting thing many times, and my daughter and other people report it very commonly, and that is when they start something that kills Babesia, at first the Babesia are paralyzed, and so they actually feel better for several days or a week with starting or ramping up an anti-Babesial, but then the die-off begins and the herxing starts up. It's called Jarisch-Herxheimer reaction. This is this is prolonged. It goes on for months and months. Again, ID doctors would never understand it, infectious disease people, because they think, if you give an effective antimicrobial, you're going to kill everything within a few days. Mental and physical activity, like I mentioned, can bring about herxing because of the increased blood flow. And how bad a person herxes is due to these factors. How many Babesia do they have? How strong is the stuff you're giving them? And how bad is their immune reaction? How strong is it? There's herxing everywhere. All tissues. It can be severe brain herxing, and everybody differs where they have most of their load. So in some people, it's mostly gastrointestinal, and so that there are people who usually had a history of irritable bowel syndrome. So they get a lot of gastrointestinal herxing. Others get a lot of pulmonary herxing. They get cough, that's very bad. And there's a great deal of psychiatric herxing, which you probably, many of you have some experience with. So when you're killing bugs that are in the blood vessels of the brain, you can imagine what that does to the surrounding brain tissue. Inflammation is increased because of the immune reaction. And there's even a leakiness of the blood vessels, small blood vessels. And what I discovered over and over is that my daughter was not having side effects. And I've not seen side effects of these very new generation antimalarials in people. What it is herxing. But, it scares doctors, scares patients, which I'll show pretty soon. And as a matter of fact, labs can get pretty abnormal if you are engaged in a pretty large die-off, including liver and pancreatic enzymes. So yeah, the barriers to treatment I was just mentioning. I see so many people who the doctor believes they have Babesia or a test was positive, but they don't get very far in the treatment because the herxing is bad. The patient thinks it's a side effect of the drugs. The doctors think so too. If there's some hemolysis evident by a low haptoglobin level or heme in the urine, they get scared and say, oh, we got to stop this. And so, people don't get well treated. And if you don't give a strong enough anti-Babesial treatment to actually lower the number of Babesia and actually get rid of them, the ones that are interacting with the immune system, you can herx forever. And I've seen this. People just never get well. They take an anti-Babesial, maybe an antibiotic also, and they just feel worse for months and months and months. They're not getting better, so they stop the treatment. Doctors are afraid of using the tafenoquine doses that are needed. because tafenoquine is approved at a very low dose for malaria. Well, I just mentioned that Babesia are 1,000 times less sensitive to antimalarials. But doctors don't want to step out of the FDA-approved doses for the medication, so they will just stick with the regular low doses, whereas I've seen people who needed much higher doses to get well. And like I mentioned, one need not add fibrinolytics in. But many doctors do that and do it early and aggressively, and then they're basically breaking up too many nests at once, and that's making people too ill, and they both get afraid and they stop. The next part of the story, Bartonella. Maybe it's just me, maybe it's my practice, maybe it's the patients I see, but every sick person I've seen has both of them. And I think it attests to how common they are. I just mentioned Babesia odocoile and larval transmission. Bartonella you can get from all kinds of places. You know, if you've got cats and dogs and they ever get fleas, or if you have any interactions with stray cats or dogs, you can get Bartonella. The mechanism of it, I'll discuss in a second. Again, it is probably more common than Lyme disease. A study in Brazil recently with an insensitive PCR test found Bartonella infection by PCR in the blood in 20% of blood donors. Imagine that, and that's an insensitive test. It's a very amazing bacteria. It suppresses the immune system more than any other infection, so it's the only bacteria that can course through your blood and you can have no fever whatsoever. It is amazing. Dr. Breitschwert, the world expert on this organism, says that one of the lipopolysaccharide that it produces is more immunosuppressive than prednisone, milligram by milligram. It gets into the tissues a bit. Apparently it gets into collagen. And this is where these two infections are very different than Lyme. As presenters have told you, Lyme gets out of the bloodstream. It likes to get into tissue, so it starts to cause tissue damage. And that's why doctors could figure it out, because it was really obvious. So it gets into the tissue of the brain, it gets into the tissue of the heart, and so on and so forth. Whereas Bartonella and Babesia mostly stay within the red blood, within the intravascular space and the red blood cells, and so they're not really damaging tissue in the way Lyme disease can do. But Bartonella loves collagen apparently, because you've heard of the Bartonella striae. Many people have realized they had Bartonella only when their kids had these, crazy marks on their skin. A little bit about Bartonella. This is a major method of transmission is fleas, because the fleas will suck the blood of the cat or dog. They defecate on the skin of the cat or dog. And what does the dog do when they got an itchy spot? They scratch, they lick. And now they've got Bartonella on their claws and in their mouth. And so if they bite you or claw you, and that's particularly true of cats, you get Bartonella into your bloodstream. And so it is primarily, its niche is the intravascular space. We think it lives within endothelial cells and travels around getting into red blood cells to go to other areas. And I had a slide like this for babesiosis, but I took it out. Didn't want too many slides. But babesiosis, bartonellosis, the same. Both of the acute forms are known to the CDC and IDSA. The chronic forms are denied, even though they are proven over and over again to exist. They know cat scratch fever, and they know that they don't have to treat cat scratch fever because the fever goes away and then the person is fine. But they're now chronically infected, which the CDC doesn't understand. Bartonellosis, also the diagnosis of it, again, much later than Lyme. It was not really known until the early 2000s. It was the AIDS epidemic that actually clued people in, like Dr. Breitschwert, to the fact that there was Bartonella infection, chronic Bartonellosis in humans, because they would get HIV, immunosuppressed, and they'd start to break out with these excessive blood growth, or blood vessel growth, hemangiomas and so forth. vascular tumors. Right now, the only really good lab we have for antibodies is Galaxy. IGeneX does antibody testing, but I don't find it to be nearly as sensitive and specific as Galaxy. So Galaxy tests for 4 species now. It used to be 2. But they're finding 4 very commonly in people. T-Lab, I mentioned their fish test for Bartonella. It's hard to treat if you've got babesiosis. Imagine if you've got these intravascular nests, the ultimate biofilm. They've got Bartonella in them too, and perhaps Lyme disease in some cases. And so Dr. Mosieni was frustrated. He would treat people with like maximal anti-Bartonella treatment for years, and they would still have it. And I think it's because the Babesia co-infection. Maternal fetal transmission is a big problem. I think many children are born with Bartonella. I'm not so sure about Babesia, but Bartonella for some reason causes a great deal of psychiatric dysfunction. Maybe the basal ganglia sensitivity I mentioned, but I think this is a large reason for many children being born with severe and having severe psychiatric problems early in life. I said, it's only recently been proven. And so since 2008, Dr. Breitschwert's group and others around the world have been showing that Bartonella is, in the blood of sick people. People with neuropsychiatric problems, rheumatologic problems. I talked to Ed Breitschwert at the last ILADS meeting, and I said, what is it going to take? You and your colleagues have published paper after paper showing that Bartonella is chronic, and yet the CDC and the IDSA don't even mention it. It's insane. And now, Breitschwert's group, like I said, they found this better PCR target, so they can actually find otocoile with PCR. And they recently published a paper where they found 7 ill people had both Babesia otocoile and Bartonella species by PCR testing. So the proof is getting out there. It's a question of when the mainstream deadheads will start to, reform. So think about these 2 species, Bartonella-Babesia. Dr. Breitschwert's group and others have shown that these are ubiquitous in the animal world. Almost all animals are infected with both of them, and sometimes several species of both of them. So they are cooperating, and they're in the same place. They both inhabit the intravascular space, so they're running into each other all the time. They have learned to cooperate and collaborate, basically, in producing chronic infestation. And again, I think the reason, maybe one of the reasons everybody I see has both of them is because if they only have one, they don't have to see a physician. Maybe they don't get ill enough, their body controls that one infection they have, and they don't end up, being highly symptomatic. I collected this group of symptoms from these papers, but I do not know how many of these are Babesia or Bartonella related, because they didn't rule out babesiosis in any of these people, but they did prove that they had Bartonella and these symptoms. I can tell you though, with my daughter, we had an interesting experiment. I mentioned low-dose immunotherapy. We used a Lyme mix. This is with Dr. Ty Vincent. He's the top guy in LDI. We separated them and gave her only Bartonella or only Babesia antigens. And we did see differential flaring. They don't call it herxing, they call it flaring when you take a stronger dose of this super dilute low-dose immunotherapy. So the Bartonella, as you can see for her, was mostly all this, very, very bad psychiatric stuff. Perhaps somebody who mostly had pain from Bartonella would have just gotten mostly pain from Bartonella antigens. Whereas Babesia was more like a flu-like syndrome, severe fatigue, even a delirium instead of the psychiatric problems where she was like disoriented and couldn't think. lowers the blood pressure, so you get more POTS and heart racing, nausea. So both of these are in the blood vessels of the brain. And I think until proven otherwise, anybody with psychiatric conditions should be considered to have these infections. They're both in the vascular system of the brain, and that inflames the brain tissue. When you have both, it's much worse inflammation. The basal ganglia, it gets hypermetabolic, and that's what I saw in what was seen in my daughter's PET scan. It's very sensitive to inflammation, and there's decreased dopamine or dopaminergic signaling, which can lead to apathy and anhedonia. And so there's this whole issue, of now it's been recognized there's a disorder called PANS. And it's thought to be purely sort of a cross-reaction of antibodies to the infection that cross-react with your own brain. And often, though, the immunosuppressive treatments don't work, as they didn't work for my daughter, because there is ongoing infection. And the inflammation from that infection is the primary problem, not any possible autoimmunity related to the immune reaction to the organisms. And in general, when people have both of these, the worst herxing and the biggest improvements come from killing the Babesia. So often I just give anti-Babesials at first because it's diagnostic for me and the patient. Look, you took anti-malarials and you had all these symptoms and you're getting better. It's just anti-malarials. And it is far more inducive of inflammation. Babesia, it's a protozoa. It's a very complex organism. It's like having a bug in you, literally compared to a simple bacterium. And so our body can react to it with much greater inflammation than it reacts to Bartonella and Lyme if it gets exposed and if the body starts reacting to it strongly. Well, about my Valerie, it's a sad story. But, I think she probably got Bartonella first at some point in her life. Because it's so immunosuppressive, that helps to explain why she had no reaction to the Babesia when the ticks got her at age 10. But the presence of the Babesia, I think, caused more inflammation in her brain, and so it went beyond just having some emotional dulling to having a real torment. And by age 14, she was suicidal for a while. And until we got her kind of diverted into doing some other things. Like I said, what I'm describing to you with my daughter is the heaviest infested person I have seen. Nobody has come close. And I've been able to help people, very fortunately, with the treatment that I'm recommending here. They're telling you what I did. But like I said, it took 2.5 years to kind of even get up to the highest dose of fibrinolytics, because every time she would add the nattokinase to lumbrokinase, the first time we did it, after 2 days we had to stop the nattokinase because the synergistic effect of loosening up the fibrin nests was excessive and released too many bugs. We were clearing, she had gotten on to the highest lumbro-natto dose in October, and her need for steroid went up as we had seen before. She, I think, because the inflammation in her brain is why she had to take steroids to such a degree. But she caught a virus, a rhinovirus, and it threw her into hemophagocytic syndrome. You probably haven't heard of it. Most physicians are not aware of it, but it is the most intense, severe immune activation syndrome that exists. So the immune system becomes so hyperactive, it literally attacks every tissue in a person's body, their brain, their heart, their lungs. It's got about a 60% mortality rate, and she succumbed relatively rapidly. Her blood was tested, and tissues, I'm trying to get confirmation of the otocoile. But Bartonella was found in her blood by PCR. So you see what I'm saying about these are not curable, especially when they're combined. That was post-mortem blood. They still got Bartonella henselae. And she probably had 6 years of the most intensive anti-Bartonella, anti-Babesia treatment anybody has ever received. Psychiatry needs to be reformed, not just infectious disease, but they are the problem, because the IDSA and the CDC, because they are in denial about these infections, as others have said here, doctors won't go there. They don't know about it. Your neurologist, your rheumatologist, your primary care doctor, they're going to say there's no infection. There can't be. You know, there is no chronic bartonellosis. There's no chronic babesiosis. Intrauterine infection, as I mentioned, can cause children with disturbed emotions. I've heard a story from a few parents who had kids who were disturbed from the day they were born, sometimes ended up killing themselves, you know, by the time they were 13, 14. If you're born with distorted emotions, you don't attach to other human beings. So this can create a whole different group of psychiatric problems due to the attachment disorder. So basic psychiatry, you need to rule out brain inflammation. It's so simple. And one way you can do that is that PET scan. If it's abnormal, this is not a simple software problem with the person's, programming in their childhood or whenever. And they need proper testing at the best labs, and only those labs can find these infections. So other labs, worthless. LabCorp, worthless. Quest, worthless. Even some of the Lyme labs are worthless for finding these infections. And lastly, even if everything comes back negative, and I think somebody has one of these infections or both, I will give them a trial of atovaquone. It's a perfect clinical diagnostic test because it's a latest generation anti-malarial. It only kills malaria and babesia, and maybe toxoplasma and a couple other things. But if they herx and or improve, they have babesia. They have babesiosis. And then later you'll often get a positive test because you've exposed the organisms. Now they're making more antibodies to them, and you can get a positive antibody test. Or if you're killing them, rapidly at the time, the FISH test is more likely to be positive because they're coursing through the bloodstream. They're dead bodies. So we really, what I'm telling you here is it's not just Lyme disease anymore. And everybody who's chronically ill should not be given a waistcan diagnosis of post-Lyme syndrome. These infections need to be investigated and ruled out. Again, they're both very common because of the way they're transmitted. And when you have the combination, you get this typical kind of illness with the severe exertional intolerance. I think most mast cell activation is caused by these infections. It is in the people I see. And it responds to treatment. You get the number of the load down. You get their immune system to calm down because it's not interacting with so many parasites, and they get better. I'm sure many here have already thought that many autoimmune diseases are probably related to these chronic infections, and this more will be learned now that much more that these infections we actually have tests to detect them. And again, if they're negative, consider a trial of atovaquone or even tafenoquine. You have to do a test called G6PD before you give people tafenoquine. And herxing and improvement proves that there is babesia. So that's all I have, folks, and I'd be very happy to answer questions. Got to be a question or two. Yeah. Go ahead. You're first, I think.
I have two questions. How do you see co-infections complicating treatment like EBV and chlamydia? Because they're quite high in certain areas.
Irrelevant, in my opinion.
Irrelevant?
Irrelevant. Consider this. For decades now, doctors have been confronted with these sick people. And so their Lyme test was negative, or they got treated for Lyme. So what is it? Well, they go looking through the tea leaves. Do antibody testing. Oh, you've got antibodies to Epstein-Barr. Oh, you've got all these chlamydia antibodies. Oh, you got these mycoplasma antibodies. And so, these infections are so common and causing so much trouble that people have searched for explanations. I can tell you this, though, the grain of truth in all of it is if there's anything else irritating your immune system or causing immune activation, you're going to be sicker from the parasites. So that's where mold comes in my view, and a whole bunch of other things, food problems and so forth. Get all those antigens out of your life that are causing you to react more, and you may get much better. Yeah?
And the other question, might it be complementary or efficacious to use proteolytic enzymes like serrapeptase along with the treatment for lumpectinase?
Serrapeptase is just a lot weaker than lumbrokinase or nattokinase.
I was thinking with the cytokine cascade induced from that.
I don't know how fibrinolytics help with the cytokine cascade. Mostly it's going to increase it, because if you start releasing Babesia, you're going to start having a greatly increased immune reaction. But there's very little real testing, but in one test that was done, serrapeptase was just a lot weaker.
Right. Thank you.
Yes, you're welcome. Holly.
So I have a question, but first I just wanted to tell everybody that Galaxy Labs and T Labs, physicians in New York State can't, as of this moment, can't.
You got a huge problem in the state.
Yes, which is due to the fact that there's regulations in New York State that all tests have to go through something called CLEP, the Clinical Laboratory Evaluation Program. And until that happens, that's a real limitation, because those are the best labs for those kind of.
Yeah, it's good you mentioned it. So you New York folks may know, how can you get testing at Galaxy? Apparently you have to get the kit sent to somewhere, other state. I think you have to give an address from another state, and you have to go to another state to get your blood drawn.
Or you have to see a provider who has an office in another state.
No, that's not enough.
Well, it depends.
I have asked them for clarification, so I hope to get more information on that.
Yeah, I hope so. So I just a couple of quick questions about the Borrelia photocoi.
Yes.
So is the deer the reservoir?
Yes.
Is that what you're saying?
Right.
Wow. Okay.
So deer Babesia, deer ticks.
Yeah.
That's so simple.
The reservoir was meaning the thing.
They are the reservoir.
The ticks are
Yeah.
just actually.
It's been found in the white-tailed deer, in studies of white-tailed deer. And there are several articles on reindeer and elk and deer populations in zoos and confined places that had a epidemic of otocoile and got very ill.
Okay. So the other one was when you mentioned that Babesia was more, I think it was like GenX Labs says that Babesia is more common than Lyme disease. Was that in the treatment test or?
No, that's the samples they receive. Just all the samples they get from physician-ordered tests from all over the country. They get more Babesia positives than Lyme positives. And I know that from the horse's mouth. I know Dr. Shah, and she actually put it on a poster at ILADS.
So these would be the tests, so in other words, when they do the whole panel of tests.
Yeah, they do their whole panel. So
because not all tests, not everybody orders all the.
Yeah. So the Babesia tests are the fish, and before the immunoblot, it was their Tunkhannock antibody that was picking up all the positives. And some other lab did the same thing. They found these Tunkhannock antibodies in a large number of blood donors, much larger number than microti antibodies.
So does the Tunkhannock then cross-react with otocola?
Yes. There's a well-known issue of immunoassay cross-reactivity. Immunoassays are not very specific. And so if you have large numbers of antibodies to otocoile, it will cross-react with their Tunkhannock antigens. So it will look like you have Tunkhannock antibodies, but you really have otocoile antibodies. And that is being shown up in the immunoblot, where many people now are negative for their more specific Tunkhannock and microti antibodies, but positive for Babesia genus. Yeah, and I want to say something, and I'm not saying there is no Lyme and that Lyme's not serious. I'm not saying that at all. I'm just saying that maybe it is well treated in most people with doxycycline for a prolonged course or ceftriaxone, and because I've seen a lot of people who've gone through the Lyme disease treatment. But they have a chronic syndrome that's very different than Lyme. Lyme is just, gets into tissues. It's like syphilis. It's a different disease. And so when you see all this non-specific, multi-organ stuff and severe fatigue, you've got to think Babesia and Bartonella.
Yeah, so my daughter also had Bartonella, which I did, discuss. But
Is she fine now?
what's that?
Is she good? Is she fine?
Would you knock on wood? Yes, she is. And I'm very, very, very sorry.
Yes.
What happened to your
Thank you. Thank you. I would say Babesia is still quite a possibility, but if they're fine, I would never treat them.
Thank you for your talk, and I'm so sorry for your loss. One, I just want to let people know that, you can't get galaxy testing. Some of the other testing is not available in New York State. That is one of the reasons why we have to go out to the office, so we can offer all the tests.
Oh.
It's a secret sauce, and I wasn't going to say it now.
So they use it. How do you get, if they're in New York, how do you get them tested through Burlington? Okay. Talk to me later. Out back. Yeah.
Mycoplasma, toxoplasma.
Yes.
They're all burdens. And I appreciate Bartonella-Babesia is absolutely a problem. But all Lyme, Epstein-Barr, mycoplasma, you have to look at the whole picture. So I do appreciate it. I also want to say that in terms of hygienics, our office really does not send a lot of Lyme testing to hygienics. That's because one of the tests that we order is medical diagnostic labs. It's covered by almost everybody's insurance. So therefore, we actually try to save the resources for tests that we think are more likely. So we will send more Babesia and Bartonella testing to hygienics than other. And Galaxy Lab is a great lab. It is interesting what you said. PCR positive is more common with Babesia. In my finding with Galaxies, there are 3D testing. Also, Bartonella, really the most common is Bartonella coli, which is not tested through most companies except for Galaxy. So just to know that it's a wonderful talk. It's a very complicated disease, but I'm going to say Lyme is really important. I don't want that to be dismissed. And also, the treatment that you've stated is all oral treatment. All treatment really should be considered for 3 months. If it's not effective in 3 months, you have to really push forward. So, otherwise, thank you so much.
Thank you for your comments. Are we done? One more.
So, our child has been diagnosed with schizophrenia, has been on antipsychotics for 6 years and is doing 95% better. But because of all the information of the last 2 years that we've heard that it could possibly be related to ticks, should we go through that process? I mean, paranoia can be an issue with a person with a psychiatric, and so we try to downplay things so we don't increase his fear or anxiety. But it is a question that we have.
It's a tough question. You don't know exactly what's going to happen when you start treating these two. In most cases, the results are good. There is herxing, and indeed, if his psychiatric problems are related to these infections, they're likely to get worse before they get better. So it is a step one has to take, with consideration. In many cases, there's no question, but the treatment has to be given. So one step would be to try to get the best tests at the best labs and just see if you can find an answer. And then you can decide on whether to treat or not after.